know that around 20% of dogs in the UK will have a lungworm infection at some point in their lives? Lungworm is a parasitic infection caused by various species of worms that set up home primarily in the lungs and the airways of our dogs. A lungworm infection can cause various symptoms, including coughing, difficulty breathing, lethargy, weight loss, decreased appetite, and in severe cases, when left untreated, it can lead to respiratory distress and even death. I'm Laura and welcome to Dragonfly. Today's video has quite a lot of information in it, so I have added chapters, so please do feel free to use those if that's better for you. Lungworms are totally different to intestinal worms, such as tapeworms, hookworms, whipworms, which I did cover in another video, which I will link up here or here for you. So first up, the three most common lungworm species are French heartworm. This is one of the most rife lungworm species affecting dogs, particularly in certain regions of the world, such as Europe and North America. In the UK, French heartworm used to be relatively rare, but it is on the increase. This lungworm mainly affects the pulmonary arteries and the right side of the heart rather than the lungs. It has a complex life cycle, with slugs and snails being carriers of the parasite. French heartworm should not be confused with canine heartworm, which is a completely different parasite and it's not currently found within the UK. Fox lungworm is another species of lungworm which is especially common in areas with big fox populations. Fox lungworm primarily lives in the tubes of a dog's lungs. And then we have hedgehog lungworm, which infects the respiratory system of dogs as well as other wild and domestic mammals, such as hedgehogs, who eat slugs and snails carrying the lungworm as their source of food, and that's how they get it. There are a couple of other species of lungworm that can affect dogs, but in today's video I am just covering the most common ones. So how do dogs get lungworm? Well, some lungworms live on hosts or carriers, such as snails and slugs, as we've said. Dogs become infected by eating those creatures, either intentionally or accidentally. If your dog is prone to a bit of slug snackage, it is important to keep your garden as clear of them as possible. Dogs can also get lungworm by eating infectious larvae directly from the environment, such as licking slug and snail trails, eating contaminated grass or plants where slugs and snails have been, drinking from puddles where slugs and snails might have slithered through. They may pick up items from the garden that have slugs or snails on them, such as toys or tennis balls that have been left out. In addition to eating, dogs may pick up lungworm by inhaling the infectious larvae, particularly when sniffing or exploring areas where infected wildlife, including foxes and hedgehogs, have pooed. Sniffing infected poo or rolling in fox poo can cause this infection to spread, so it is super important to give your dog a bath if they have indulged in a bit of poo rolling when out and about. Reggie, I am looking at you there. Once the infectious larvae are eaten or inhaled, they then travel through the dog's body to the lungs and the respiratory system, where they mature into adult worms, and they basically live in the lungs and associated tubes. So from there they reproduce and they release eggs, which are coughed or pooed out by the dog and contaminate the environment. What are the symptoms of a lungworm infection? There is a range of symptoms which can vary in severity depending on factors such as the species of lungworm, the extent of the infection, and the dog's overall health. But it is important to note that some dogs are asymptomatic in the early stages, which means they may not show any signs at all of an infection. So persistent coughing is one of the most common signs. The cough may be dry or produce mucus or blood and may worsen with exercise or excitement. Lungworms can cause inflammation and damage to the tissues in the airways, leading to difficulty breathing or shortness of breath. Dogs may exhibit rapid or laboured breathing or wheezing. Infected dogs may appear tired and lethargic or weak. They may have reduced energy levels and be reluctant to engage in normal activities such as playing or exercising. Lungworm infection can lead to a loss of appetite or a decreased interest in food. Chronic lungworm infection can result in weight loss. This is often due to the metabolic demands associated with fighting off this infection and the energy expended in just breathing. Some dogs may develop a nasal discharge, which can be clear, can be mucus-like or even tinged with blood. The discharge may be accompanied by sneezing or nasal congestion. In severe cases, dogs may experience gagging or vomiting, particularly if they cough up mucus or blood associated with the infection. Sometimes there is a fever, although this symptom may not always be present or apparent. It's important to note that the severity and combination of symptoms can vary wildly among individual dogs, and some infected dogs may show only mild or intermittent signs of illness. What does a lungworm cough sound like? A lungworm cough may be dry and hacking, resembling a repetitive cough, a little bit like when we have a dry, tickly throat. The cough may sound harsh or raspy. It may occur frequently or repeatedly throughout the day, even when your dog is at rest. The cough may occur in bouts or episodes with multiple coughs occurring in quick succession. It is important to note that while a dry, hacking cough is often associated with lungworm infection, other respiratory conditions or diseases can also cause a similar coughing symptom, so it is always vital to consult with your vet if you're unsure. How do you know for sure if your dog has got a lungworm? The most common method for diagnosing a lungworm infection is analysing poo samples in a lab and the use of a lungworm test kit, which I have linked below for you. This looks for the presence of lungworm eggs or larvae. I've put a screenshot of a positive lungworm test that one of our customers at Dragonfly received. You can see what it looks like when you get your results. It tells us what type of lungworm the dog has. This result shows us that the dog has a fox lungworm, but only one larvae was seen in the sample, so that is quite easy to treat quickly. The most larvae I have seen on a positive test is 4, and that does indicate that the infection is quite established. How do you treat lungworm? Well, treatment typically involves a combination of medications to eliminate the adult worms. These medications are specifically designed to kill parasitic worms. The choice of medications may vary dependent on factors such as where the country you live in, species of lungworm, and the severity of the infection. The brand names that I'm aware of in the UK, Panicure, a broad spectrum medication that is often effective against lungworm. It works by disrupting the parasite's ability to absorb nutrients, leading to their death. These medications are typically administered orally in a tablet form or liquid form once daily for a specified duration as prescribed by a vet. We then have Advocate. These medications belong to a class that work by paralysing and killing the parasites. They're available in various formulations, including oral tablets or spot-on treatments. Can you treat lungworm naturally? Unfortunately, there are no natural remedies that have been proven to work against lungworm. Many natural worming remedies such as grapefruit seed extract, diatomaceous earth or pumpkin seeds effectively target parasites in the digestive tract. As lungworms reside in the respiratory system rather than the digestive system, Once an infection has taken hold, we recommend treating with prescribed medication just to ensure that the lungworm infection is dealt with. We want it to be dealt with swiftly. I have had one customer that felt strongly that she wanted to go down the natural route and tried treating her dog's lungworm with grapefruit seed extract. But unfortunately, on retesting, the lungworm infection was still present. So she did end up having to treat with a chemical medication anyway. What happens if you don't treat lungworm? So untreated lungworm infection can significantly impact your dog's overall health and well-being, leading to reduced quality of life, impaired mobility, and chronic discomfort. So prompt diagnosis and appropriate treatment is absolutely essential. Lungworm is not an infection that will just clear up on its own. How common is lungworm? So in Europe, lungworm infection is considered relatively common, including the United Kingdom, Ireland, France, Germany, and Scandinavia. Studies have reported rates ranging from 2% to 50% in different regions and populations of dogs. So whilst I accept this is an indicator of how common it may be, we run a worm testing service at Dragonfly, and we test literally thousands of dogs every year, and on average only 20% of the results that we get back are positive, and this is a mixture of lungworm and intestinal worms. So I think 20% is a good guideline for the UK as to how common it is. Can you prevent lungworm in dogs? No, you can't prevent lungworm, but you can be vigilant to reduce the risk of your dog getting infected. So don't leave toys in the garden overnight. Unattended toys and balls can hide slugs and snails that your dog may accidentally eat whilst playing. Once playtime's over, take the toys back inside and practice good hygiene. Promptly remove and dispose of poo in the garden from foxes and hedgehogs. And if your dog likes to roll in fox poo, ensure that you bathe your dog as soon as you get home to prevent your dog licking or sniffing the area. Reggie loves to roll in fox poo, so I always make sure that I wash his harness and his collar too on a high heat. Regularly cleaning and disinfecting food and water bowls that are left outside is also imperative. Can you see lungworms in dog's poo? In most cases, lungworm are not visible in dog's feces with the naked eye, and this is because lungworms typically inhabit the respiratory tract of their host animals, including dogs, and it is only their eggs or larvae that are expelled from the body through coughing or swallowing, rather than the actual worms themselves passing directly through the digestive tract. And this is why lungworm is hard to diagnose and needs 3 separate samples of poo to see whether any larvae are present, because they can be hard to detect if the dog is just coughing them out rather than coughing them up and then swallowing them back down. There you have it. That is a very deep dive into the revolting world of lungworms. As always, please feel free to leave any comments or questions below and I will absolutely answer them for you. If you haven't already, I would be really grateful if you would hit that subscribe button for more content. And if there is any burning questions you've got on another topic that you'd like me to cover, please feel free to leave that below too. So from me and Reggie, thank you for watching and we'll see you on the next one.